Okay, so good morning. It's truly my pleasure to welcome you all to our official kick-off event for this first ever European Public Health Week. And I'd like to thank Casper and Maastricht Campus University for generously offering us the premises here in Brussels and hosting us this morning. I would also like to extend a warm welcome to all of you out there who are following us online. And for anybody in the room who would not like to be part of this live stream, I would ask you to accommodate yourselves behind the camera. So this European Public Health Week is an initiative which was the brainchild of our Executive Director, Dineke Siegers-Paget from the UFA office. And Dineke has been working extremely hard over the past weeks with Deborah, Miranda, thank you Deborah too, in order to make this first Public Health Week a reality. Of course, we embraced this idea wholeheartedly, and we found a tremendous amount of support and engagement from other like-minded organizations, since we believe that it is very timely in view of the upcoming European Parliament elections. It's an opportunity to recognize the great advances that have been registered in health within the European continent over the past 50, 70 years or so, and even more recently, since the start of this century. And of course, this is possible partly because of the European experiment that has brought peace and prosperity. However, equally, we wish to highlight the importance of health as part of the upcoming European elections, because we need to warn against complacency. The greatest threat at the moment is to think that we've ticked the health box in the last century, that Europe is doing fine and that nothing could go wrong. And we've seen this very recently with the outbreaks of measles, a disease that was on its way to eradication from the European continent. Not only, however, there are myriad emerging health challenges due to a combination of socioeconomic realities and growing inequalities, technology developments that risk leaving some parts of the population behind, and emerging environmental risks. We are grateful to the European Commission, who agreed to co-organize this event, which is partly funded through the European grant which we have received as UFA, as well as to the Regional Office for WHO in Europe for all their technical advice and for agreeing to support this event. And now I would like to show you a short video which explains the aim of the week and how all people and organizations can get involved. Between the 13th and 17th May, we are organizing the first ever European Public Health Week. Why did we do this? Because we want to celebrate health and healthy populations, but we also want to raise awareness about the problems that can arise in safeguarding and maintaining health, as well as showing our gratitude for all those who care for people who are ill and unwell. So join us, organize your events and activities, use our materials and tag us.
I hope this week will be full of talks about awareness and prevention, especially on vaccination. Et passons tous une bonne semaine de la santé publique.
I expect stronger coalition of partners for public health in Europe.
Úspešný týždeň európskeho verejného zdravia.
I expect stronger coalition of partners in Europe.
Prajeme príjemný Európsky týždeň verejného zdravia.
This first European Public Health Week is a great opportunity to get knowledge on every single theme. Each day a new content, a new topic through webinars from all around Europe, so new perspectives from other countries, and also a great chance to mingle through local events, especially in France. Donc, rendez-vous à la semaine de la santé publique.
I expect for this first European Public Health Week an opportunity to share knowledge and passion about living and working in the public health sector. Auguri a tutti per la vostra settimana.
Hello. I expect that the European Public Health Week will raise attention to the problem of public health in society. Бажаю чудового тижня громадського здоров'я в Європі.
I'm looking forward during European Public Health Week to meet loads of people at the Stopford Building, University of Manchester, and in particular to find out more about antibiotic drug resistance. Have a great European Public Health Week.
I hope that this upcoming edition of the European Public Health Week raises awareness, especially between young people, on the vital role of public health in shaping healthy population. And in particular, I hope that it brings people together to fight youth mental health stigma. Buona settimana europea della sanità pubblica a tutti.
It's crucial not to forget how One Health approach is important for public health. We should all advocate for animals' health and welfare for public health. Herkese mutlu Avrupa Halk Sağlığı Haftaları. Türkiye'den sevgilerle.
Between the 13th and 17th.
Great. So I think through this video, as you have seen, we have a different theme for each day of the week. And today we start by explaining the importance of building daily physical activities in our lives. You will see we have prepared a small event later on this morning. And tomorrow we complement this by recognizing the importance of healthy environments. Many people cannot engage in physical activity because of the quality of the immediate environment that they inhabit. Wednesday, we shift the focus towards caring for our carers. Yesterday was International Nurses Day, but it's not only the health workforce, it's also all those unpaid, voluntary people within their homes caring for others who we want to praise and celebrate and genuinely show our appreciation for. On Thursday, we dedicate our day to healthy and sustainable diets for ourselves, for our children, and for our planet. And finally, Friday, this month, May, is Mental Health Awareness Month, and we decided to place a focus on mental health in young people. I would like to say how encouraged we are by the positive response that we have had. At the last count, we know that there will be more than 100 events taking place in over 30 countries this week, including as far away as Bangladesh, Brazil, and South Africa. And at this point, perhaps I would like to introduce Thomas Dorner from the Austrian Public Health Association. The Austrians already have quite a considerable experience organizing this kind of activity. We would be grateful if you could share your reflections with us.
Okay, thank you very much, Natasha. We in Austria, we started to celebrate the Public Health Week in 2016, and the idea was to do it in the frame of the European Public Health Conference, which was taking place in Vienna in 2016. And we had the idea, we have a huge conference here with 2,000 participants, most of them scientists, and we do science in public health. But what are we doing science for? It's not science because of doing science, but we do science because we want to make the people healthier. So we wanted to have the participation of the public, and that's why we decided to reach the public through campaigns. And we wanted to make campaigns about what is health, that health is not only the absence of disease, health is much more. There are many determinants of health, and there are many things people can actively do to contribute towards their own health. That's why we decided to do the Public Health Week the first time. We also knew about the example from the United States of America because they had this National Public Health Week every year, and also the former President Barack Obama was opening the Public Health Conference, and we really wanted to do it as well, and that's why we decided to do it, to get involved the public and to reach the public through our messages. This was the first reason. The second reason why we wanted to do the Public Health Week was to get different public health stakeholders involved, especially those who are doing public health and do not know that they are doing public health. And those very important stakeholders for public health are, for example, scientists in many fields of science, not only in the field of medicine, of course, but also in the field of social science, in the field of nutrition, in the field of sports science, in the field of economy, in the field of ecology. They're doing public health, but most of them do not know they're really doing public health. On the other side, there's the social insurance. They are also doing public health. Many people do not know that they are doing public health. And of course, there are decision makers, politicians in many fields of politics, not only in the fields of healthcare, but in every political field. And we wanted to get them involved. And another very important player in the field of public health, and especially a very important partner for the national or the European Public Health Week, is the media. And we started to make media campaigns about different aspects of health. And this year we are very happy that we are not alone in Austria, that there is a European Public Health Week, that there are so many countries participating in this Public Health Week. And this elevates public health even on a higher level, and I think we can reach much more together as European, and we are very happy to have this European Public Health Week. And we in Austria decided to make our Austrian Public Health Week the same week, so we also start our week today. And our topics are also in accordance with the European Public Health Week. For example, today we are doing a campaign together with the Medical University in Vienna. We had a nice publication about the association between physical activity and activities of daily living in the elderly people. And the message of today in our Austrian Public Health Week is that you should engage in physical activity according to the recommendations. And this also helps elderly people to help them with their activities of daily living and their instrumental activities of daily living.
Thank you very much, Thomas. And having been also in Austria last year when you organized your event, I can testify to the commitment, enthusiasm, and serious way in which you are taking this forward. And as Thomas said, one of the key things that we would like to achieve is actually building bridges with so many other practitioners and professionals who are working for public health. And therefore it is with pleasure that I would like to introduce Patricia Flynn from the Council for Occupational Therapists in Europe, with whom we have increased our collaboration over the past months, and we look forward to future initiatives. Patricia.
Thank you very much, Natasha. And first, before I begin, I'd like to thank UFA for involving us, the Council of Occupational Therapists for European countries, in this first EU Public Health Week. And I'd particularly like to thank you for involving us in this kick-off event. And I'd just like to talk to what Thomas has just said as well, and I'm wondering if you know the role that occupational therapists also have in public health. And I'm delighted to hear you talk about elderly people and activities of daily living and instrumental activities of daily living and all the health benefits that come from that. So that's very heartening. So again, our involvement in this event is a recognition of the role that occupational therapists all over Europe have in promoting public health and well-being. There's strong evidence that involving occupational therapists in public health policy, public health planning, and public health service delivery is effective and it's cost efficient. So occupational therapy improves lives and saves money. Research has shown that investing in occupational therapy at public health level and primary care level, it reduces hospital admissions, it reduces GP appointments and the necessity for GPs to do home visits, it reduces A&E admissions, it reduces and it increases the appropriate referrals to community and to health and social services in the community, excuse me. But most importantly, there's better health outcomes for the people that we work with. What do I mean when I say better health outcomes? Occupational therapy, by definition, promotes meaningful participation in the community. And we do this through engaging people in purposeful activity, like Thomas mentioned. That's a very good example, in real environments. So it's in the home or in their communities. Occupational therapists have specific expertise in the interplay between individuals' skills and abilities, their social and physical environment, and the activities they need to need to or want to engage in. So, for example, I want to refer to the 5 themes of this Public Health Week with a few examples of what an occupational therapist could do. So if we're to look at the theme for today, physically active, an occupational therapist would often work with an individual such as an elderly man recovering from a stroke to help him to return, to support him to return to maybe his beloved morning swim, thereby helping him to remain active and engaged, and all the different auxiliary health benefits that come from that. If we look at tomorrow's theme, the healthy and accessible environment, an occupational therapist might work with a young person who uses a wheelchair to support them to attend their chosen university and to live independently with other students in a healthy and accessible environment. And as Natasha said, having a healthy environment, it's very important that we remember a healthy environment on your doorstep has to be accessible. It has to be accessible to the majority of the population. And accessibility, I think, is a factor that often might be missed in public health when we talk about healthy environments. In terms of the care for care, so looking at the healthcare workforce, an occupational therapist could conduct an ergonomic assessment, say, of if a GP has arthritis, to allow them to continue working and manage their with reduced fatigue and pain. And then again, allowing somebody to continue working has knock-on benefits for their health in terms of mental health, in terms of engagement with the community, in terms of managing symptoms. And looking at our last theme, a woman with our second last theme, the healthy diets, a woman with dementia could be supported by an occupational therapist to engage in a community gardening project, thereby contributing towards her own sustainable and healthy diet. And again, socializing with other people and maintaining function. And lastly, and certainly not least, in terms of youth mental health, occupational therapists routinely work with young people with mental health difficulties, such as maybe a young girl with social anxiety who wishes to take part in her local youth group. So what's the common thread amongst all that? What does an occupational therapist do? What we do is we keep people active in a meaningful way and engaged in their communities, which we know instinctively. We all know instinctively, but also very strong evidence shows that this promotes health and well-being. I have one last job to do, which is to promote the event tomorrow at 4 p.m. GMT, that's Reykjavik time also. I want to ask you all to please download the Travable app, so that's travable.is. In order to, this app allows users to register accessible places in their cities and cities they visit, so that other people with reduced mobility and mobility issues can research their trips beforehand and move freely throughout different cities. Okay, thank you very much.
Thank you, Patricia, for this overview showing how indeed occupational therapy can contribute to all the key areas that we have identified. And it is now my pleasure to introduce Mariam Lobyanidze from the University of Georgia. Mariam, would you like to tell us how you are participating in this Public Health Week?
Thank you, Natasha, for introducing me. So it's an honor for our university to participate in first ever European Public Health Week. So we think that young generation are the key who will be responsible for public health in the future. So since we are the university, we wanted students to be involved during the whole week. So we tried to give them some space and freedom to come up with new ideas, and they were really enthusiastic to plan the activities. For example, for today they choose a really nice recreation zone in the capital of Georgia. This is Lisi Lake, it's called Lisi Lake. And they invited professional trainers to demonstrate group exercises in karate, in rehab, and fitness workouts, and they will encourage their peers and community members to be involved in group exercises. And also, we collaborated with the local NGO. It is a woman for Winner Women's Club, who will emphasize today that the role of physical activity is really important in rehabilitation process after breast cancer. After all, they will have walking hour, as we are going to do today, around the lake. And their message is students for promoting physical activity. Also, we wanted to involve some role models of the community in this week. So we contacted Ladwa Prasava, who is a teacher in one of the villages of Georgia. The village is Chibati. He is a teacher in public school. He is one of the finalists of competition for the World's Best Teacher 2019. So he was really excited and happy to be involved, and he, with his students and community members, will make discussion, and after group exercises to demonstrate that the physical activity is really important. Our aim was to spread our words throughout the Georgia, not to stay only in capital. So we collaborated with National Center of Disease Control and Public Health, and they informed and spread our European Public Health Week flyers and key messages to municipal centers and encouraged population to be involved in and celebrate the week. We hope that this will be tradition in the future, European Public Health Week, and we will be excited and happy to be involved. So I wish you all, more than 30 countries, success with their activities, and thank you for inviting.
Thank you, Mariam. And I think Mariam has reminded us of the importance also of another very widespread and key group, our educators, our teachers, and the young people. And I think listening to you, sometimes we are confronted by the fact that young people are not interested, are not active. I think the recent movements that we have seen in relation to climate change have just shown how active young people can indeed be. And I think we are trying to invigorate the same kind of activity in the area of health. So it is with pleasure now that I introduce one of our young, active public health specialists, Pasquale Cacciatore, who will tell us about what is happening from UFA next.
Yeah. Thank you, Natasha. Is this working? Yeah. Good point that you raised about the climate change and the role of young people in raising awareness on many principles that we really feel close to. But let me just say one thing before talking about the importance of the young participation to initiatives like this first edition of the European Public Health Week. And it is the fact that, in my opinion, we are living in an age of hate, in which we are probably more defined by what we hate or what we feel discomfort of, rather than by what we love. And in this sense, I want to really highlight the fact that this European Public Health Week will focus on the positive messages. This has been the approach since the beginning, and I really thank you for stressing, or thank you all the people supporting this, for stressing this part, because we really need positive messages, as public health is the science of promoting and protecting health of people and communities, and I believe that our actions and experiences can be powerful tools to inspire, enlighten, and empower all people if they are shared as positive messages. So I want to stress off this point here. And in this sense, I really believe that this European Public Health Week will bring so many young people together from different parts of Europe who will join forces and spread the spread the positive messages over the 5 days on the different topics. And it has been widely acknowledged that the young public health workforce can really can be engaged as a real partner in addressing all the critical issues of public health. And millennials, I'm sorry if I'm using this word because I think that it has been widely misused over the last years, but I think that it fits particularly well here. Millennials can really change the future of public health. I really believe that, because they are cost-driven, they are hardly motivated. Think about the millennials, about climate change, for example, like you were just quoting some moments ago. They are hardly motivated to fight for all the fundamental principles of public health because they really feel they are close to them. They also understand and value the role of networking and the interprofessional relationships, and they are really ready to put their workforce and to inspire other professionals in the field of public health with their young energy. And I think that at the end of this European Public Health Week, we will get this message that we can rely on the youth workforce, and we can and we should work with the future of public health, the future young professionals, to achieve our main goals. In this sense, one of the main goals of this week will be raise the awareness on the importance of public health, on why public health matters, on the way that it positively impacts on our daily lives. So my real wish for this first edition of the European Public Health Week is to see the highest number of young people participating in it, to the different events that people can really see on the websites and join both physically but especially online. And let me add a small point. I'm particularly close to the final day of this week, the final topic, which is youth mental health. And I'm particularly happy that this was chosen as the key topic for this first edition of the European Public Health Week. And I'll tell you a small story here regarding a young public health professional. Paolo was a close friend of mine, and he was also a public health resident doctor, just like me. He was involved in so many activities. He had a vibrant personality. He traveled a lot, also here in Brussels, doing so many projects. And he was exactly my age when, about 1.5 years ago, he took his own life abruptly, with no early signs. So I believe, and I really hope that we can do a lot as young professionals in public health to shatter the mental health stigma. As I was saying in the video that you saw before, we can and we should work together, because we have to shape the narrative here in terms of youth mental health, to make people understand that it's okay not to be okay, and as the motto of the day says, I'm me even when I'm bruised. So we have to create a different world, a different setting in which it's much more comfortable for young people to ask for help, to reach out for help, and in which it's much more comfortable for professionals or other people from communities to provide help. So again, I really encourage all the young people from all around Europe to join all the events of this European Public Health Week, and also share the activities of the final day of the week using the hashtag Young Mental Health to show how young people look after for their own mental health. So again, have a nice European Public Health Week to everyone.
Thank you, Pasquale. Thank you for sharing your enthusiasm, but also thank you very much for sharing your personal story. I think we all are affected by these stories, and when we count all these many stories together at European level, at national level, globally, we make information and statistics. And the information and the statistics, people in public health, who are often our unsung and invisible heroes, are the ones who allow us to really assess the situation, understand where we have success that can be celebrated, but also where there are warning signals that must be heeded. And therefore now I finally would like to turn to Nicole to tell us from the data science specialty, what are your objectives and contributions to the European Public Health Week?
Yeah, thank you very much, Natasha. You already have introduced our topic very well, so I'm representing the UFA section on public health monitoring and reporting. We have subscribers from universities, but what makes me really happy is that we have a lot of subscribers from public health institutes on national, regional, and also local level. So these are the people, as Natasha described, who collect data, who make use of official statistics, who summarize these data in terms of indicators that are quite often and hopefully internationally agreed on so that we can compare also across European countries. And then write reports, press releases, policy briefs, give presentations, and so on the distribution of diseases and health determinants. That's what we are doing. With regard to the European Public Health Week, of course, health is heavily influenced of being physically active and following a well-balanced diet. That are two topics of the European Public Health Week, but two other very important lifestyle factors are smoking and having a responsible behavior in terms of alcohol use. And all these lifestyle behaviors, all these lifestyles influence the main non-communicable diseases like cardiovascular diseases, cancer, or the most common cancer sites, mental health, and diabetes. And in public health monitoring and reporting, it is our task to report on the distribution of these diseases and the prevalence of these lifestyle factors in the population and in different population groups. But we must be very careful that we do not oversimplify this, because health and health behavior is not only influenced, health is not only influenced by the health behavior, it is pretty much influenced by a lot of other factors. These are the social determinants of health. These is the environment, the topic of tomorrow, and the context in which that we live, learn, work, and love, the Ottawa Charter principle. And we have a bit of a difficulty in public health monitoring and reporting to really focus on these factors and to report data. And I would really state that we need to be strong in communicating that we need a good balance between individual approaches to promote health and the promotion of political choices for health. So this is one aspect. And the other aspect is that we really need a multi-sectoral response to influence health. And with multi-sectoral response, I look for transport, urban planning, social security stuff, and so on. And since we have a bit of difficulties in covering all these broad topics in public health monitoring and reporting, I'm really happy that we made it to organize a webinar for tomorrow under the healthy environment perspective, where we have the possibility to introduce a tool from Scotland. It's called the Place Standard tool that covers 14 dimensions of places. It focuses on the place environment and the social environment of places. And this is a wonderful opportunity to gather data on regional and local level. With the Place Standard tool, the population who lives there is involved and rates all these aspects of daily living and helps then public health experts, city planners, and politicians to prioritize, okay, what is most needed in this area so that people can live a healthy life in the place they are living. So tomorrow it's from 11 to 12 CET that we meet online. It's our first experience to do this with the Scottish people who explain the tool. Then we have a practice example from the Shetland Islands who have used this tool. We have a practice example from the Netherlands because they also liked this tool and started to translate it and use it in the Netherlands. And we are curious about the questions that come up during this webinar. Thank you very much.
Thank you very much to Nicole, who has also explained the activities that they are carrying out and brings our very rich panel introduction to an end. At this point, I would just like to check whether there are any questions or comments from any of the guests in the room, or whether there are any questions that have come in online. Not yet. So I don't know whether there is anyone who would like to ask a question to our panel members. No, they were very clear. So I will take perhaps a little bit of time to remind everybody that last week UFA actually issued our own statement with our asks in terms of the upcoming European elections, where we highlighted the need for all political parties to give more attention to big health threats. We already noticed that there are some health threats that have been captured in some of the political party manifestos, thanks to the work that has been carried out by one of our interns, Nina, here. But I think what we want to emphasize is that it's not just, for example, about tackling cancer in its late stages with access to medicines and screening, which is important, but also to understand the wider determinants of health, and therefore the importance in general of tackling the political and commercial determinants of health upstream. I think as UFA and also as part of the Do More for Health campaign, which we were part of with the European Public Health Alliance and many other organizations, we have made it very clear that we see a continued need for a dedicated health commissioner to continue to be available in the forthcoming commission, as well as to have a vice president who is really responsible for sustainable development and well-being, and this in order to have the much needed balance between focusing on industrial and economic growth priorities and the sustainable health and well-being goals as part of the broader sustainable development agenda. We think that in this way, the European Union will truly be able to develop much needed framework for tackling non-communicable diseases, for extending support to national health systems, to empower citizens to play the roles that they have a right and duty to play within the health system, as well as for Europe to really establish itself as the leader within the global health strategic context, a context which is much, much needed at this present moment. And therefore, I think that in this way, we are also, as UFA, reaching out beyond our traditional comfort zones. And I'd like to announce that as part of this strategy and our preparations for the period 2020 to 2025, as of July this year, we shall also be operating with a satellite office within Brussels to increase our visibility and advocacy efforts. So I wonder if perhaps there are no further questions from the audience. Perhaps I can come back to you with some additional questions. Thomas, if you had to say, I mean, this is one of the questions which we often ask ourselves. What is the added value of the European level? What is needed at the European level that cannot be achieved at the national level? If you reflect on what you have been doing in Austria at the national level, what are your asks from the European level? What is the additional value of such an activity at European level?
Okay, thank you, Natasha. Interesting question. The first thing that comes to my mind is, of course, we cannot solve many problems not on a national level. Many problems can only be solved on a European level, if we think about climate change, for example. But basically, I would say what we need for a more broader level than the national level is to get data and get science, because the most knowledge you can't only do on a national level. So we need to make the cooperation between different universities. We need to get European perspectives. We need to get European data, because we need the data for evidence-based decision making, and that's a very important issue in public health. And many decisions are made on European level and have to be made on European level, and therefore we need the data that the decisions are really made based on facts and not merely based on something.
Thank you, Thomas. Nicole, increasingly we are facing this kind of backlash. People have had enough of experts, people question data and evidence. What is your response to that, and how can we make sure that data scientists can make their information more appealing in this day when expertise and data and science are being heavily questioned?
Okay, thank you. I think also a response to Thomas' comment. When was it? It was on Thursday, just a few days ago. A colleague of mine will be retired in late summer, and he was in our region from the very beginning involved in the development of health indicators. So it started end of the 80s, beginning of the 90s. And that age already, they were involved in a European project to develop health indicators. And I read the foreword of this report that they wrote, and of course it was, we need more data and we really need to find definitions and comparable data across Europe. So it was known already from, shortly after the Maastricht Treaty. And I thought when I read this, okay, well, that's still true, huh? Still we say, as you, we need better data, we need more comparable data. And we have achieved already so much. We have the European Health Information Survey with comparable data on obesity and overweight, on several diseases, on self-reported health, and so on. So we achieved already a lot, but still, you are right, we are not at the end. And it can be even better, especially in terms of morbidity statistics, where we really lack some information. So that's the one. It still can be better, but we already made quite a mile towards really more comparable health information. And I'm also a member in the European Health Information Initiative, where OECD and WHO Europe and the European Commission and Eurostat sit together with member states, and they are discussing how they can reduce data reporting burden. That's another sign of the side of the medal. If all people request data, then the statistical offices in the countries really have a lot of stuff to do to report these data, and quite often they are very comparable, and they negotiate how they can align this better, but they are also really working on how to improve the database. But this always, as always in public health, needs also a bit of time. So that's the one thing, and the other thing, your question regarding what do we do, how do we fight against fake news and so on. I think from my point of view, we really need to improve the way how we report data, that it is easily accessible, everyone can use it, that it is appealing, and so on. And the past years at the European Public Health Conferences, we had a lot of workshops on how to report data, how to write policy briefs, how to write key messages, how to develop infographics, and so on. And I think this is a way to make it more appealing, more accessible, and to communicate about the distribution of health and their determinants on and on is the only way we can do.
Thank you, Nicole. I would like to turn to Mariam again. Yes, of course.
Can I reply one sentence to Nicole? I definitely agree. There is more and more data in public health, and this is very good. Where I do see the problem is that still many decisions, especially on a national level, many decisions are not based on facts. And in my feeling, this is more and more increasing in many European countries, and many European countries have the problems of populistic parties and populistic parties that make decisions not evidence-based. So I think especially therefore we need the European level, because also in my observation, European decisions are not that much based on something else and much more based on our findings. And so I think one of the most important tasks we as researchers have is to make a lobby that decisions are based on actual findings. So.
Thank you, Thomas. We've made reference to the upcoming European elections, but of course the European region is far larger than the EU with 53 countries. What is the perspective from Georgia about this need for working more together to collect the evidence and data at European level? Do you feel part of this? Do you feel a need for this?
Thank you for the question. So as you know, Georgia is in the process of becoming a member of European Union. Some people think that the reason for this is the economical sustainability, but we think that we share the values of European Union countries. Like this week, for example, we share the value of solidarity and accessibility for all, and I think Georgia will be always supporting such kind of events, and also to share the experience of UN and to support more evidence-based decisions in the local level and to make our contribution to the European society and society of the world. So I think we are going in the way of UN and UPA as well.
Thank you. Maike is saying that we have a question.
I actually have a question for the panel. Since Nicole mentioned that already 20 years ago there was talking of issues that we still talk about now, it made me think that I have a question for the whole panel, for each panelist. So this week we're celebrating healthy populations, and we have the 5 themes for the 5 days based on what we're celebrating or current challenges we have now within public health. What do you think that in 10 years, in a decade, what are we celebrating during the European Public Health Week? Or what will be the challenges that we have to put attention to? I was wondering what your thoughts are on that. Thank you.
Does anybody wish to take this? I'm tempted to ask you, Pasquale, because you are the next generation, and it would be very nice to envisage. What do you wish to have solved by then, and what do you think are going to be the new and emerging challenges? Any thoughts?
Well, that's a very, very tricky question, very tough to answer. But I definitely think that there will be one major topic in the future which will affect all of us in the future decades, probably in 10 years. We'll be celebrating a new type of health, which is already happening here. I mean, has been happening for like decades now, which is e-health. And probably in 10 years, we will be much more focused on that. Probably we will just have one single topic and we will be like, let's say e-health, all the ways that health will be shaped by artificial intelligence, by the analysis of big data, which is already a reality. It is already happening now. But think about 10 years from now, in the future. I think that it will be a major revolution. So, in my opinion, that is what we will be celebrating in 10 years. Hopefully, we will just celebrate all the other topics. I mean, we won't have any other problems to discuss about, just a celebration on our healthy lifestyles, our healthy living, our healthy aging, the respect and passion for our health workforce. But I think that we'll definitely talk about e-health much more.
Thank you. Patricia?
I think just building on what you were saying, Pascal, I think that we will be, and I hope we will be, celebrating increased connectivity and engagement, so that events that happen at a European level don't seem so distant from what everyday people do in their everyday environments at home. And I think that's the big difficulty, and maybe why there's that negativity around research and expertise, is because it seems distant from what I do in my everyday home, especially if I have challenges. accessibility challenges or health challenges. And I think e-health and social media and connectivity, I think the mystery will be gone from it. It will be there, it will be embedded, and I hope that we will come around to a phase where it will be used for positivity and real engagement and real influence, so that the policies and the services and the decisions that are made are based on what people live in their everyday lives. So, hopefully.
Thank you. Nicole?
I hope that we celebrate that we really see less health inequalities across population groups, that health is really equally distributed, and I really hope that we celebrate that we don't sit here as public health specialists when you're from occupational therapy, but also very close to health, but that we have here also city planners, people who think about pension schemes, about support for deprived persons and so on, so that we really have a multi-sector, multi-professional panel sitting here. Yeah.
Thank you. Thomas?
Okay. There are a lot of things which I would hope we would have saved in 10 years, but with many things I'm skeptical. I think climate change will still be an issue 10 years from now, and I also think nationalism also will still be an issue 10 years from now. Where I do see hope that what we can have solved in 10 years is regarding the reorienting of healthcare systems. Because I see there's many changes are now currently heavily under construction. I think in 10 years, primary care will play a high role in many European or in most European countries, and it will be reorganized towards that not the disease will be in the focus of care, but the patient will be in the focus of care. The patients with all the medical and social and psychological obstacles, but also resources will be in the care, and it will be rearranged in direction of integrated care, and that also not only prevention but also health promotion will be a crucial part of the care for patients, and not only the treatment and curation of diseases and rehabilitations. And this also needs the involvement of many different types of healthcare workers, for example, occupational therapists or therapists in any fields, and medical doctors and nurses and social workers and so on. I think this might be, I think we could have managed in 10 years from now.
Thank you. And Marian,
Yes. I think it's better to think that the public health is the work of all of us, not only the politicians or someone else. So I hope that after 10 years, we will celebrate these organized efforts of all community, different stakeholders to reach better health for everyone. And also about e-health, we have to try to use e-health to support better lifestyle, for example, physical health, to improve the level of our health and life. So I think lack of physical activity will still be an issue after 10 years, and we have to start some prevention events now to gain the fruits after 10 years. Thank you.
I have no doubt that if we continue to work in this vein and we manage to really reach out to people and explain that it's in their interest and make people passionate about their own health and well-being, that we will have quite a great deal to celebrate. Sometimes things that seem impossible actually do happen if there is sufficient political will that places the resources in response to people actually making claims for them. So I think on this optimistic note at this point, I would like to hand over to Denike Siegerspaget to give you a flavor about some of the events and activities which we have picked out that are happening, and to wrap up this introductory session.
Thank you very much, Natasha. Thank you very much, panelists, for
your input and your vision for the future. As was said, we have 30 countries participating. When we started, our aim was to have at least 10 countries, so we definitely reached that aim. There was an enthusiasm which was enormous throughout Europe. There's several activities organized in countries. Today we have dancing in Kazakhstan, if you're interested, treasure hunt in Malta. We have yoga, a class in a park in the Netherlands, and we have a workout with senior people in Lithuania. We also have a flash mob in Bulgaria, and Bulgaria is the country that organized the most events. So that's also something we did not expect, and we're very happy that they're so active and hopped on the bus of the European Public Health Week. We have seminars and lectures in the Czech Republic, Poland, Romania, Portugal, Slovakia. In Greece, we have a seminar for public health professionals, specifically on how to work with migrants. So that's very good. In Turkey, we have the medical students in this week gathering the cigarette butts around the university and presenting these to show smoking is still a big problem in the country. The University of Manchester is one of the partners that are organizing activities every day, an exhibition at the university that changes every day related to the topic. So that's what the Austrians, of course, are doing something every day. And a lot of our countries are retweeting messages and trying to get the message across to the whole population. So I think it's going to be, if everybody does what they're promising, a very successful week. But to end this, first of all, visit our website or follow the hashtag EUPHW to join activities and many more and retweet our messages. We also have a nice exercise for you, which is we're going to do a walk-in-hour. It's just a networking walk where we walk to the European Parliament. Maaike will give us some stretch up and warming up ideas. The online attendees, we would like to invite them to join the UFA Facebook page because we will show the walk-in-hour there as a live event as well. And finally, thank you, Natasha, thank you, Marianne, Patricia, Thomas, Nicole, and Pasquale for coming here and presenting your case. And thank you all for coming here. Thank you very much.
Okay, so I don't know how you guys feel, but we've been sitting for about an hour. Except for the panelists, they had to do some standing up in between. So to get us ready for the walk-in-hour that we are going to do just after this, I want to do some stretches with you. I hope that you join me if possible. And I have some stretches for each panelist. But we'll all join, not to embarrass anyone. So please stand up to get us ready for some stretches. And we're going to start with Thomas, Austria. And in Austria, I believe there's a lot of mountains and you can do really nice skiing. So we're going to do some skiing on the Austrian mountains. And you can join me. Okay.
Do you cross country or downhill?
Oh, yeah, this was downhill, I thought, yeah. And then we go over to Patricia, Kotek. You all know the YMCA? So now we make the Kotek. We start with a C, then to an O, and then a T, an E, and then another C. Yes. Then we go over to Georgia. I believe there's also some nice mountains in Georgia. And we go snow. Okay, the highest peak of mountains in Europe. And we do some snowboarding there. So we get on our snowboard, go down. You can tell I'm not a snowboarder. Then we go over to Italy and Pasquale, and we do some soccer, since I know you are a big fan of soccer.
Like every Italian.
We kick the ball. Bueno.
Now I'm curious.
This is a surprise. I know that somebody likes horseback riding, so we go horseback riding. Get on your horse? Yes. Okay. Thank you all for participating. I hope you join me for the walk. The sun is shining here in Brussels, so perfect. Thank you.